Hello, my name's Linda Gask and I'm Emerita Professor of Psychiatry at the University of Manchester, and for many years I was a consultant psychiatrist. I've done a lot of teaching and research into depression, and it's something that I've also experienced myself. I'm going to talk first of all about what depression is, and that's really the first part of this course. Depression symptoms can be split into 4 different components, and I'm going to take each of those in turn. The first is, as you'd expect, emotional. When people get depressed, they experience low mood and have something called anhedonia, which is a loss of interest or pleasure. Sometimes their mood is also very much worse in the morning and improves towards the evening. They can start to feel very guilty and worthless, and that life isn't worth living. And they can also start to feel suicidal. The second set of symptoms are what we call cognitive symptoms, because they're to do with your thinking. People may say that they don't feel they're able to think clearly. Sometimes they describe it as like being in a brain fog, and also not being able to concentrate clearly. And they may complain of poor memory, and sometimes this can get mistaken for dementia, when actually the person is suffering from depression. The third area of symptoms are the physical symptoms, and depression isn't just an emotional problem, it's also very much experienced physically. A person can feel very slowed up, or alternately they can actually be quite agitated, and they can experience losing weight or actually putting it on and not being able to sleep, or alternatively feeling like they want to sleep all the time. People often have difficulty getting off to sleep, and then in quite severe depression they may wake early in the morning. The last set of symptoms is to do with behaviours, and that's really how depression makes you feel. When you feel down, you start to avoid people and avoid situations. The problem is that by isolating yourself, that can actually make you feel more depressed. And when people are very low, they can stop taking care of themselves, stop looking after themselves, such as by brushing their teeth or washing, even getting dressed or changing their clothes. They stop being able to function, and that has an impact on their work, on their family, and of course on their relationships. Now, I want to draw a distinction between what we call unipolar depression and what we call bipolar depression. And this is quite important. There's an important difference here. First of all, how is depression actually diagnosed? Well, a lot of people have problems with the idea of a diagnosis, and you will read quite a lot in the books about the advantages and disadvantages of diagnosis. But as a psychiatrist, when I diagnose someone, what I'm doing is I'm recognising a set of symptoms that commonly occur together that give us some idea about what might happen to that person and what types of treatment might be effective. And diagnosis is used quite a lot in research as well, in order to make sure that if you're researching a group of people, they have similar characteristics. So to qualify as having something that's called major depression, you have to have a certain set of symptoms for at least 2 weeks, and your functioning has to be quite different from normal. So the symptoms are, first of all, these 2 keystone, really, symptoms of depression, as I mentioned earlier. Low mood, which isn't the same as unhappiness. Low mood is where you actually start to feel quite different from being sad and unhappy. It's feeling very down and very low, really feeling that there's no pleasure or joy in life. And loss of interest or pleasure. Those are the 2 really key underlying symptoms of depression. And then 4 or more of the following, which again are some of the things I mentioned earlier. Change in sleep, change in appetite, loss of energy or motivation, poor concentration, feeling guilt, feeling slowed up or agitated, and having suicidal thoughts or feelings of hopelessness that life really isn't worth living. Depression can be mild, where you just have a few of those symptoms, or it can be moderate, or it can be severe, where you have all of those symptoms. It may also be psychotic, where people start to hear voices, or perhaps have other experiences which are out of keeping with real experiences, where they start to feel that they are being perhaps persecuted, or they're hearing voices telling them to harm themselves, or other experiences. And in depression, those experiences fit with the low mood. In other words, they are depressing things. You might hear a voice saying that you're worthless, or you've done something terribly wrong, or life isn't, you should harm yourself. And those are the kind of experiences that people have when they are psychotically depressed. Now, I must say that that is the very least common variety of depression. We're talking about maybe 1 in 100 people, or even less. But that is what severe depression is like. For many other people, depression is much less severe. And it can be a single episode, or it can be recurrent. And again, more rarely, it can become chronic. People can stay depressed for a number of years. But the majority of people who get depressed do make a recovery. And I think it's important for me to say that, because some of you may have experienced some of these symptoms, and it's important for you to know that people can get help for them. Finally, how common is it? Well, if you look at a 12-month period, probably about 6% of the population have major depression in a 12-month period. But over our lifetimes, the risk is considerably more, probably around 15 to 18%. And about 1 in 5 of us will get depression at some point during our lives. It also very commonly occurs with symptoms of anxiety, feeling very tense, very worried that something awful is going to happen, along with physical symptoms of anxiety, such as feeling sweaty, churning stomach, butterflies. And these symptoms are all more common in women. From adolescence onwards, really depressive symptoms are more common in women than in men. Bipolar depression, to have bipolar depression, you have to have episodes of something called mania as well. And bipolar disorder used to be called manic depressive disorder. And when you're manic, you're absolutely the opposite from being depressed. You have loads of energy, you want to stay up all night, you want to do all sorts of things. You may become delusional and think that you have godlike powers, but also you can be very agitated and sometimes very angry because people are trying to thwart you from doing these things. So in bipolar disorder, people have both depression episodes, but also these very high episodes called mania or hypermania, which is a slightly less severe form of mania. And this is much less common, probably around 4% of the population in a lifetime. And the treatment really differs.